A person who has been diagnosed with OSA must consider all the treatment options and their outcomes. Although treatments for OSA may seem like a nuisance, patients must consider the consequences of not being treated. It is estimated that only 10% of patients with OSA are being treated. The majority of these people either choose to not be treated or do not know they have OSA. Let's now go over treatment options for obstructive sleep apnea. We will start with behavioral treatment. OSA patients should avoid alcohol and sedating drugs. Alcohol, sleeping pills, and tranquilizers can worsen OSA by causing the patient to become more relaxed, increasing the chance of the airway collapsing. They should also avoid tobacco use. Smoking can irritate the airway and increase the swelling of the air passages. Another treatment for OSA is weight loss. Losing weight can improve sleep apnea significantly. Patients should avoid sleeping supine. Because of gravity, the airway is more likely to become obstructed when a patient is sleeping on his or her back. Non-surgical treatment options include behavioral changes, CPAP, BiPAP, dental appliances, and medications. We will now go over each one of these options. Let's begin with behavioral changes. In some patients, obstructive apneas can occur only in certain sleeping positions. The most common position is supine, which is lying flat on the back. If this is the cause of the OSA, then a patient can try to avoid sleeping on his or her back. Since obesity is a common contributing factor to obstructive sleep apnea, a healthy lifestyle and diet that encourages weight loss will also improve obstructive sleep apnea. CPAP is currently the most common and effective treatment for OSA. CPAP is a non-invasive treatment for patients with OSA. A CPAP machine filters room air through a hose and mask, which delivers a pressure of air that is higher than the patient would normally breathe. This higher pressure of air acts as a mechanical splint to hold the airway open, which prevents the airway from closing. BiPAP is a form of treatment similar to CPAP. The difference between the two is that CPAP provides a continuous pressure and BiPAP uses two different pressures. One pressure is constant during inhalation and is known as the IPAP. The other pressure is constant during exhalation and is known as the EPAP. BiPAP increases patient tolerance and is also used to treat central sleep apnea. Another treatment option involves dental devices. A dental appliance is used to pull the jaw forward while sleeping. It does not require surgery and is generally fitted by a dentist or oral surgeon. A dental appliance holds the jaw and tongue forward and holds the palate up. This prevents closure of the airway. Dental devices in some cases can increase airway size and often control mild apneas. Although PAP therapy is the most effective treatment for OSA, some healthcare providers may prescribe medications. This is not very common. Because obstructive sleep apnea is due to an anatomical airway narrowing, medications are highly unsuccessful. The most common medication used is for people whose apnea is caused by a nasal airway obstruction. Nasal steroid sprays and topical nasal decongestants have been shown to be somewhat effective. These sprays can temporarily improve nasal swelling and congestion. Patients who have obstructive sleep apnea associated with hypothyroidism or a low thyroid hormone production see an improvement in OSA with thyroid replacement therapy. People who have obstructive sleep apnea due to obesity may improve with diet medications if the medications are effective in helping them lose weight. Although there are medications like Provigil that will help increase alertness and temporarily increase attention, they do not treat the cause of obstructive sleep apnea. Surgical treatment is usually the last resort. It can address the nose, palate, tongue, jaw, neck, obesity, or more than one of these areas. Surgery success rate varies by the type of surgery performed and is different for each patient.